Thank you for joining us. Our show today will focus on advances in healthcare and a conversation with the founder of the Life Extension Foundation, Bill Faloon, and the president of Gardens Wellness Centers, Cheryl Martin. We'll hear their views on this topic following these messages.
At Gardens Wellness Center, we provide a full menu of holistic services under one roof. Services to heal the body through chiropractic care, acupuncture, and colon hydrotherapy, and services to heal the mind through hypnotherapy, neurolinguistic programming, and life coaching. We practice functional and Chinese medicine and offer a full herbal pharmacy. Visit us today and take charge of your health.
You know you need CoQ10 and fish oil for your heart. You also know you need a multivitamin to maintain your health. But what you don't know is that an award-winning CoQ10, fish oil, and multivitamin are all made by Life Extension. Why settle for less than the power of science, the power of life, the power of Life Extension?
They come to Israel for a week, all expenses paid. We show them the place, especially we introduce them to the people who make up the local scene in the field that they write about.
We're at the organic farm at the Mitzvah Yomi.
I'm here with a Druze healer who's been taking us through a bunch of different herbs that are good for a variety of different conditions.
We just made the most amazing homemade traditional Israeli falafel. We actually baked it instead of fried it, which is awesome.
So we are here in Klil Village, which is a very eco-friendly village in Israel. And we are at a beautiful home making all kinds of raw vegan chocolate treats.
Through Vibe Israel, we basically are getting people from around the world to understand what Israel's all about, what being Israeli is all about. They have an amazing time. It's all about the experience. It's not just about facts and figures. They fall in love with the people and they write about their experiences and share what Israel is all about with their millions of followers.
Yummy.
With us now are the founder of Life Extension Foundation, Bill Faloon, and Cheryl Martin, president of Gardens Wellness. It's a pleasure to have you both with us today. And I would like to say this is a great privilege, as always, Bill. And I'd like you to tell our audience for Health and Life and the other programs we're going to air this on, what your thoughts are with regard to the current status of medical research at this time in history.
Well, there's great news. People who have cancer, who are concerned about developing cancer, there are now proven ways in which they can intervene through dietary means to reverse the progression of the disease. A recent study just came out last month, year 2015. It confirmed a 2005 study showing that men with prostate cancer, if they remove red meat, preserved meats, dairy products from their diet, and switch to a diet based on fruits, vegetables, nuts, legumes, they reduce their risk of that prostate cancer killing them by 2.5 times. This is huge. If a drug were developed that worked that well, it'd be on the front pages of the newspapers. Instead, it's buried in medical journals because people just don't pay attention to nutritional changes that could save their lives.
Why is that so, Bill? Why is it not made public?
Well, it's somewhat suppressed. The dairy industry does a lot of advertising. They don't like studies that come out to tell people do not eat dairy, do not eat red meat. But based on the accumulation of evidence, there should be warning stickers on meat and dairy indicating it can increase the risk of cancer and can also increase the risk of mortality if you already have cancer.
I think what people need to understand is that we're all born with a genetic makeup, and sometimes that genetic makeup has the cancer DNA. We can go through a large portion of our lives with never having any sort of disease, but our bodies go through a fight or flight syndrome where when we're in a stressful situation, a time of our life where we're focusing on career and family and we're overloaded on our schedules, our cortisol levels and our adrenaline levels start to really spike. And in that time, our immune cells start looking for what's causing those rises. When it can't fix the problem and we're running on these high cortisol levels, then it strikes the DNA and finds those little triggers for cancer and other things recurring and turns them on. What's your thoughts on that?
Well, cancer is the accumulation of mutations in genes that regulate cellular proliferation. That's really what the disease is all about, gene mutation. And as we go through life, unfortunately, we accumulate mutations in our cell regulatory genes. But there's neat ways we have to prevent that and even reverse it. There are DNA repair enzymes. Blueberries. If you eat lots and lots of blueberries or take a blueberry extract in a capsule form, you're going to benefit because it's going to facilitate the repair of those damaged genes that will lead to cancer if you live long enough.
I absolutely agree with you. So what do you recommend someone does to reverse these things in their lifestyle? If someone is, reaching an age where they feel like maybe a lifestyle of wrong choices, they're doomed to cancer, what do you recommend for someone that feels that, it's too late for them, they've had a bad lifestyle?
First component of a turnaround lifestyle change is a comprehensive blood test. We need to see what people look like under the microscope so we know what specifically is most important for them. And then they've got to change their attitude about what they eat. Food can no longer become their drug, that they'll eat whatever their mind tells them to. That can often be lethal. They have to make a life-changing decision in which food is going to become a beneficial factor that enables them to live longer and feel better. When people eat right, they feel better. Now that's a real neat benefit for also being able to live longer. So we push very much a healthy diet, the appropriate supplements based on what one's blood test results reveal.
Mm-hmm. So that's really, for my modalities that we do at my center, a functional medicine, where we take the lab reports, we do hair and nail samples and fecal and urine samples, and we look at the entire body and look for where the problem is. So what you're suggesting is that we start with labs and go with the makeup of the person and what they're experiencing from their environment and genetic sense.
Absolutely. Annual blood tests, additional blood tests of course, and other kind of tests when appropriate are just mandatory. I've had people where they come in and they get their blood drawn and they're shocked that their glucose has skyrocketed or cholesterol, and they haven't had a blood test in 10 years. They somehow feel they were frozen in time and nothing changed. But as we grow older, we do change, and we have to adapt to those changes by altering our diet, improving our supplement compliance. We have to do what our blood tests reveal we need to do to avoid chronic disease.
Bill, you have written a book entitled Pharmocracy, and you have been a proponent of an open-minded, intelligent attitude with regard to pharmaceuticals and health, yet we live in a world that is imperfect, and you've been subjected to a lot of criticism and hostility, actually. Please tell us about it.
Well, the FDA does not like the fact that the Life Extension Foundation brings out new medical discoveries years, if not decades, before the FDA says you're allowed to have them. For instance, in 1983, we recommended low-dose aspirin to reduce the risk of a heart attack. The FDA and Life Extension battled for 15 years, but Life Extension won. FDA in 1998 allowed a health claim for aspirin that it may reduce the risk of having a heart attack. So that's just one little example of the battles that go on between our nonprofit organization that's seeking to bring out timely information so that people don't die in a state of ignorance, as opposed to a regulatory agency that is suppressing the development of new technologies.
What would you like to add to that, Cheryl?
What kind of challenges do you have as a nonprofit when you're trying to bring awareness to the community and all the efforts that you're bringing out there for yourself, for your company, and the public as a general?
Oh, we run into challenges with the government all the time. They don't like the fact that we are freely disseminating life-saving educational information. They can log onto our website and review 20 years of materials that we have published. If they have a certain medical condition, they can type that right onto our homepage. It will bring them to a plethora of articles that we have published that will reveal unique treatments that their doctors are overlooking. One of those examples I often cite is an over-the-counter drug called Tagamet. The generic name is cimetidine. Colon cancer patients, when they take cimetidine the proper way, they can improve their survival up to 6-fold. That one little tidbit of information about an over-the-counter drug, using it properly in the adjuvant treatment of colon cancer, can markedly improve survival.
How do you recommend people get all this information? Where can they go to get this information?
Lifeextension.com. It's real easy, or lef.org. Either one just brings you to the same site. And the information is freely available. You don't have to register your email address. You don't have to subscribe to anything. It's there for the public's benefit.
Conspiracy theorists will ask, why is such information not made publicly known?
Well, it hurts the profits of the drug companies. Right now, if you're stricken with cancer, you'll be prescribed drugs that each one will cost approximately $100,000 per year. In some cases, $100,000 per year for drugs that cost very little to actually manufacture. The drug companies do not want the type of information that Life Extension disseminates, the type of information that's being disseminated by the Garden Wellness Center. They would like to see that suppressed, because people who follow these lifestyles are not going to get sick as often.
What an outrageous example of corruption. Such a beautiful world and so many solutions exist, and it's just incomprehensible that any big business concepts could actually suppress logical and humane solutions to so many problems. What are your thoughts on that?
My thoughts? People are going to spend and do whatever they can, and they're going to base their decisions on their doctors. People are worn out. They're working too hard. They have family, they have career. They don't want to research. People are completely unaware. They need to know, and they need to get referrals to the right sources. They're letting their doctors rule their lives. Western medicine is the norm. People trust it. They don't know better. I was once introduced to the word ignorance by a friend. She said, I'm ignorant in this subject. And when she said that, I felt really bad for her, because I thought she was saying she was stupid. And I wanted to tell her, no, you're not stupid. And she said, no, when I mean I'm ignorant, I mean I'm uneducated in this particular subject. And it changed for me the meaning of the word ignorance. There's ignorance meaning you're not stupid, you're just not putting the time into learning what you want. And I think that a lot of the American public, with their schedules, are ignorant to what's available, that they have better choices, choices that can make their lives enhanced and actually save them money. They need to know what direction to follow. They need somebody that they can trust, that they can go to that site and get the information that they need. They're going to make the choices without having to do all that homework that people just don't have the time to do. So I think people need a guide. There's a lot of gurus out there that are putting out information, and unfortunately a lot of that is backed by pharmaceuticals, and it's backed by companies that are trying to make a dime off of people that don't have time to research. So there needs to be some format that people can go to that they're going to become educated. They can trust it and move on with their lives and have a better lifestyle. And I think we're congruent on what we're offering there.
There's no question there's hardcore data in the peer-reviewed published literature that substantiates that following a healthy eating pattern, healthy exercise patterns, doing what everyone knows is healthy, but they're ignoring it. It's proving itself to not only prevent vascular disease and arthritis and cancer, it's also treating these diseases. People who are undergoing these comprehensive lifestyle changes, they're getting better, and it often shocks their doctors. And this applies all the way to neurodegenerative diseases like Alzheimer's. We're seeing reversals in Alzheimer's disease in people who follow comprehensive lifestyle programs. And that means they have to do everything right at that stage. Once the memory loss starts to set in, you've got significant brain damage. If you don't follow a comprehensive program, you're not going to get the benefit that you're seeking.
I completely agree with you. I've had the luxury of experiencing at my center We have cancer patients that come in for supportive care. They're already in oncology clinics, they're already in chemotherapy, but they come in to us, recommendations that they're getting or from our referrals, and we're changing their diets. We're bringing them to the alkaline diet, and we're giving them functional medicine, and we're putting them on herbs that are approved by their doctor. We've had doctors call us and say, "What did you do?" Which is so beautiful. I am so thrilled when that happens. And a stroke patient that I've recently treated myself with hypnotherapy, I was pleasantly surprised that this Western medicine doctor treating this stroke patient had referred to my clinic. And she came in and she said, studies have shown that if you do hypnotherapy and exercise some muscles, that I can gain movement back. She was completely unmovable on left side of her body. Not paralyzed, but quite close. So I started doing hypnotherapy with her, and after 3 treatments, she was able to move her arm up and down. And I was just thrilled that a Western medicine doctor had the knowledge that these kind of alternative treatments can be beneficial to patients. So it's so beautiful to see that people are gaining awareness. It's just pointing people in the right direction on how to find it.
No question about that. With strokes, what we're doing is mobilizing people's bone marrow, literally using a drug. It's been around since 1991 to treat cancer, but when you give it to people who have strokes, it mobilizes the stem cells in one's own bone marrow to proliferate and rejuvenate part of the brain at least. So stroke victims aren't getting 100% better, but they are improving. They're gaining functionality so that they don't need 24-hour day care. They're able to get up out of their wheelchairs and function again. So the technologies are there, and they've been around for a long time. And we've confirmed these results with doctors using the exact same drug in other parts of the country, and they're reporting identical results. And yet nobody is doing this on a full-scale basis. You've got to know where to turn to. And that's what Life Extension tries to do with our website. People can check and see where there's doctors in their area that may know about these types of technologies.
That's very impressive, extremely impressive. For myself with the stroke patient, it was a mind issue where when I read this research that if a person were to meditate and imagine just in their mind that they were lifting a weight with the side of the body that was compromised, that side of the body, the muscles would strengthen over time. And so in the hypnotherapy sessions with this woman, I was having her lift weights and carry groceries and things that she can associate with in hypnotherapy, and it worked. So people that don't know how to meditate, people that don't understand yoga, they don't understand how the mind works, they're too busy, they're too stressed, they can't figure it out, hypnotherapy worked. And I was really impressed with that, and it was new for me to go into that modality and to get into stroke patients. So it's something that I'm stretching my mind in and learning about. So it was really beautiful, and I'm so honored to make a difference in her life. I want to change the subject for you into something a little controversial.
Certainly.
I was wondering how you felt about the medical marijuana industry.
Well, I'd like to see it grow. I'd like to see a lot more research go into identifying which strains of the marijuana plant are most efficacious against glaucoma, most efficacious against neurodegenerative disease, most efficacious against certain forms of cancer and its pain. So there's probably a huge amount of unknown data out there where if we could just legalize marijuana completely and then enable people to experiment with it medically, we could have one of the most powerful new drugs of all time make itself available. But right now, with it being illegal, people are getting so many different strains, it's hard to say when it's working, when it's not working, because you may not be getting the right concentration of the active ingredients.
Right. People are now focusing on Charlotte's Web, and it's really geared towards people that are seizures and disorders that are debilitating, and they're not having a functioning life. My clinic, we're trying to figure out where we fit into this, and we're looking at marijuana that you don't smoke it, you put it on your body in different fashion. We're trying to decide whether we should get into this because it's so controversial, but studies are proving, you know, even with Alzheimer's patients, there's things that you can do with this I hate to use the word drug because it's not a drug, it's a natural product.
It's an herb. It's not, it's, of
right.
course it's not a drug.
Right.
And there is some recent evidence that marijuana may be effective in slowing down Alzheimer's. Now, I heard that at a conference I attended just last week. This is July 2015, but just last week, some people were relating case histories of people who were using marijuana and their memories were improving. Now, you wouldn't think that would be the case the way they knocked marijuana use, but for certain people, there is a medical benefit. And the only way to really utilize it the proper way is to legalize it so that researchers will be liberated and can experiment freely on patients to find out how to best use it.
Right, completely agree with you. I have a friend that I've known since high school that was diagnosed with ovarian cancer, and her doctor actually told her to smoke marijuana, and her cancer came to a stalled point where everything else she did was able to be successful because the cancer somehow stopped those cells from, the marijuana stopped the cells from growing in cancer. So I'm very curious about how marijuana might slow down cancer cells so that a person can get a jump on treatment.
As far as the mechanism of action as to how marijuana might affect cancer cells, I don't know if I've read anything about that. But what I can tell you is the reason marijuana has not been legalized is the big pharmaceutical companies heavily lobby against marijuana legalization. They're making billions of dollars a year in profits on pain medications. The OxyContin type drugs that are addicting and killing people, they want to keep selling those drugs. So as a result, they spend lots of money lobbying state legislatures and Congress to keep marijuana out of the hands of people, so these people have to turn to their anti-anxiety drugs, anti-pain drugs, drugs that are addicting, that kill. Those industries don't want to lose that revenue stream. So this is the dilemma this country is faced with. The citizens have to revolt and tell their people, we're going to throw you out of office if you don't legalize something that we know is beneficial, and you're only suppressing it because Big Pharma wants to keep these dangerous anti-anxiety and narcotic pain relievers.
That's a very important point you bring up there, Bill. What actually are you involved in with that regard, bringing this to people's attention?
Well, there was a meeting that we had at our church last week where we brought in a number of experts to talk about the benefits of marijuana and also why it was continuing to be suppressed. And there is big money to be made by keeping it illegal. Big money in the private prison system, big money in Big Pharma. And big money goes into Congress and it buys influence. So we continue to have something that's a natural plant that has a huge number of benefits, can't really prove anything detrimental about it yet. It's sitting out there illegal because industries that are selling drugs to do partially what marijuana does. I mean, just imagine that people who have to take a drug like Xanax or a drug like Valium, an Ambien, whatever, to get to sleep or to relieve their anxiety, if they could just have free access to oral marijuana, to the oral THC, they may not need those drugs. So that would revolutionize healthcare for the better. But the expense would be the pharmaceutical companies wouldn't be making their billions of dollars of profit. So they're going to try to keep it out any way they can.
And you've been having quite a lot of conflict with them, typically throughout the years.
Oh, the government would like to see life extension not exist because we do challenge their authoritarian rule over what we're allowed to put in our bodies.
Bill, I'm curious. If someone didn't have all their labs ready, and they wanted to start changing their lives, taking vitamins and supplements, what could they take that you would recommend that would make their lifestyle better and their health better with a general vitamin or supplement?
When people come in, we will start them all off on an omega-3 supplement, because if you don't supplement with omega-3s and you don't eat a lot of cold water fish, you're going to be deficient. We know that by all the blood testing we do. We actually can test the blood for the omega-3 levels. So we get people on that right off the bat. Vitamin D is probably the least expensive and best documented nutrient out there. Vitamin D, as in David, you need about 5,000 IUs a day. Now that's 11 times more than what the government thinks you need. You need 11 times more vitamin D to get a disease preventative effect. And I'm talking about a 50% potential reduction in overall cancer rates. by taking 5,000 IUs per day of vitamin D as opposed to the FDA's recommended 400 IUs, which is way too low.
Right, I agree with you. It goes back to the days where humans are meant to be out there in the sun. We're meant to be chasing and hunting our food and foraging for our food. We're not doing anything but sitting at our computers.
Even people who are out in the sun, as they get older, their skin does not convert the sunlight into vitamin D the way it does in young, healthy people. Everyone over the age of 40 certainly needs to take a rather high dose of vitamin D, and then a couple months later get their blood tested. And you want it to be over 50 nanograms per microliter. If you get it over that level, you're in good shape. If it's under that level, just take a little bit more. And take your vitamin D with a fatty meal. That almost doubles the absorption rate of it.
We have to conclude, I'm afraid, but before we do you have any final question for Bill, and perhaps you have a final comment?
I don't have any final questions. I would like the opportunity to interview you again on ADHD, Tourette syndrome, other issues that I treat quite often at my clinic that have to do with children and teens. If you could give me the opportunity for that in the future.
I'd be happy, but our constituency, Life Extension, is the geriatric population for the most part. Now, we've got plenty of people who are 40 years of age who join, but it's mainly people who have felt the impact of aging already, and they're now realizing they need to do something about it. We seek to slow and then reverse, wherever possible, aging processes, the pathological aging processes that are slowly killing people and making their lives miserable in the process.
Well, I'd like to thank you both very much. This has been most interesting. We have to do this again, Cheryl and Bill. Thank you very much.
Thank you, Bill.
You're welcome.
This concludes our special show for today with Cheryl Martin and Bill Faloon. I'm Paul Peritz. Thank you for being with us.